When a student is selected for and joins the medical and health science education, it becomes the matter of pleasure, not only for the student, but also for his family, his or family, institute, and the society. However, this medical and health science education is not free from the stress and mental health issues. There are many profession-related, institute-related, and individual factors making the student vulnerable to stress and mental health issues. Medical and health science career is one of the most stressful and burdensome profession and education. And institutes, particularly, may have their own strengths and the weaknesses. An individual may have biopsychosocial risk and also the protective factors, along with the other many contemporary suggestions. In this background, so medical students and health science students may have many stresses and mental health issues. Our BBCATS study carried out in the 2008 showed that the study-related factor is almost ubiquitous. Along with the study-related stressor, almost 2/3 of the students have other stresses, like their situation being away from home, so no local guardians and the parents to monitor them, ragging, bullying, many relational, emotional, social, and financial issues, obligations, pressure, and others' expectation, and even there might be the issues with the basic needs like food, water, residences, and the weather. Along with that, exposure to unhealthy and antisocial, inappropriate behaviors like the substance, digital, and other risky and unhealthy behaviors might be the great issue among the students. So almost 1/3 of the students have one or other mental disorder at the time of the study. And among those mental disorders, anxiety and phobias, adjustment, and alcohol and substance use disorders were among the commonest ones. So more than half of the enrolled students had experienced psychiatric disorders till the time of the study. And here also adjustment, anxiety, depression, and substance use disorders were among the commonest one. Actually, more than 2/3 of the medical students use one or other substance, main being alcohol, nicotine, and even cannabis and other substance use is also there. So this very data, a little older, shows that alcohol and the other substance problem is quite a great big issue among the medical students. So in this background, we need to ponder upon, we need to discuss the ways to facilitate the help seeking among substance problem among the medical students. So some of the key questions: how to identify what are the signs and symptoms of the substance use? What are the particular risks for the medical students? What would be the obstacles in seeking help? And how to facilitate help seeking? And of course, the preventive ways, the ways to prevent the substance problem would always be the great concern for us. So, when someone uses the substances, based on the type of the substance, there would be many psychological symptoms like mood swings, anxiety, irritability, apathy, suspiciousness, difficulty in decision making, cognitive dysfunction, and perceptual disturbances like hallucination and cognitive distortions. So there will be unpredictability. One cannot make out why there is such a rapid change in their mood and effect. And also there might be various type of the physical symptoms like red eyes, changes in the size of the pupil, weight loss or the gain, tremors, fatigue, injury, signs of injury, changes in the uh, pulses, appetite, and libido. There might be changes in their behavior also. They might be suspicious. They might prefer solitude, staying longer time alone, like in the toilets, and avoiding others' accompaniment, poor sleep, lying, stealing, and risky behaviors. And also there will be gradual decrement in their performance, concentration, loss of interest, and their hygiene, personal hygiene also will be less. And so they might be absent in their activities also. So if someone has been displaying these kind of the symptoms, we might have to be cautious about the substance use, his or her substance use. So there are particular risks for the medical or health science students associated with the substance use. So with substance use, there will be the poor concentration, memory deficit, and leading to the academic decline. And so that will there will be the risk of the academic failure, ethical violations, and so impaired clinical judgment, and there will be the higher rates of the depression, anxiety, burnout, and suicidal ideation. So because they are early exposed to these very substances, increases the long-term risk of the dependence and tolerance. Among the medical and health science students, there is the higher rates of the fear of judgment, uh, and also fear of their reputation being damaged. All these leads to the will prevent from timely support. And more so, the medical students have easier access to prescription medications, leading to the increasing risks of the substance use. So there are obstacles too in seeking help, particularly among the medical and health science students. So this fear of being judged by the peers, faculty, and patients, and even their internalized guilt is more stigma, and the same is more among the health science students. And there, when they are discovered, there might be the great concern for the expulsion, disciplinary actions, and impact on their future career. So fear of academic and professional repercussion is another issue. And there might be the lack of confidentiality. So they have worry that the disclosure won't be kept private within the tight-knit medical settings. Of course, many of them may have denial or minimizes as a defense. So they may believe that the problem is not severe and that they can manage it alone. Even the substance use may be seen as common or even accepted under the stress. And also, medical students and health science students have long need of the long hours for their study and their duties. So there will be academic pressure, and the lack of the student-specific mental health services might be the obstacle in help seeking. So then, with this, how can we facilitate the help seeking in substance problem among these near and dear our medical students in this institute? So we have to ensure the confidential mental health services. We have to ensure private, judgment-free access to counselors or the psychiatrists. And also we need to organize regular workshops on the stress, burnout, and substance and coping. Anti-stigma campaigns to promote the stories of the recovery and normalize seeking help. And we need to run the peer support programs like training the senior students as peer listeners or mental health advocates. Even faculties should be sensitized. Faculties should be trained to recognize the signs and symptoms of the distress and respond supportively. We need to set up the headlines or secure the reporting systems where students can seek help safely. So even anonymous helplines and online platforms will be required. At the same time, the policy of the flexible leave and the recovery. So to allow the temporary academic leave or the support without penalizing the students. And we need to incorporate mental health in the curriculum itself. So even the consideration of the ways to prevent the substance problem would be a great thing. So how can we prevent? By building the healthy coping skills. For example, exercise, mindfulness, hobbies, and journaling to manage the stress can be useful ones. Time and stress management strategies to maintain a balanced schedule with the proper rest, breaks, and realistic goals. The students need to stay connected by maintaining the relationship with friends, healthy relationship with the friends, family, or the peers for the emotional support. And we need to limit the access and avoid the triggers for the substance by avoiding the environments like parties, peer presses, where substances are present. And peers among the students should be made accountable by forming study groups, wellness circles to promote the collective discipline. So students need to be encouraged to seek the help early. They can approach the counselor or trusted mentors when feeling overwhelmed or burnout. Of course, the individuals and all need to know their own risk factors, family history, stresses, and understand the addiction. So we need to engage our students in a positive environment. So we need to facilitate, we need to encourage students to participate in the student clubs, volunteering, or other creative activities. So we need to introspect because substance problem is so common and we might one or other way be indulged in that. So we need to ask whether we feel we should cut down on our use of alcohol or substance, or we are annoyed by the criticism of other person for our substance use, or whether we have used the substances to cope with the stress, sadness, or to stay awake or study longer. So if we have any of these symptoms, so we need to discuss with our peers and the students among the support groups with the quality listener and supportive peers. And even so, since there is a peer group now, so we can approach, you can approach one of the peer, our faculty, or even counselor, and even the department. And so visiting or seeking help from the specialist or the confidential professional help would be the great and the courageous and the wise step. So with this, we hope that our institute would be substance-free institute, facilitating your healthy, fruitful journey in the medical education. Thank you.